Hi, my name is Peyton Hopkins, and today I will be going over my unknown bacteria data analysis. The importance of identifying unknown bacteria. It is important for 3 reasons: clinical applications, being able to choose assays, and for treatment. Clinical applications, you're going to find those in your doctor's offices, hospitals, labs. Those are very, very important. Being able to choose the correct assays, and that is so we can find the correct causative agent of the patient's infection quickly and efficiently. And then for treatment, it is very, very, very important that we are able to identify the bacteria to treat them, because not all bacteria responds to certain antibiotics and some are antibiotic resistant. And so being able to know what exactly is causing the patient's illness is of utmost importance. There are some vital tests that were very important during my research: the Gram stain, the slant of growth, the litmus milk reaction, lactose fermentation, sucrose fermentation, citrate use, and urease activity. And here are my results for each of the tests. The Gram stain came back as gram negative. I had pink rods, so that was good. My slant of growth was very white, thick, glistening, and insulate. I'm not sure if I'm saying that right. I digress. It was very moist, thick, glistening, and it kind of grew in a huge puddle at the bottom. I wouldn't necessarily call it a puddle because it was very thick and yucky, but in my litmus milk reaction, it was acid. You can see that on the second picture on the right, on the left-hand side, I have the original litmus milk, and you can see it is a deep purple color. On the right is my test, and it came back a very light pink. That shows that I had lactose fermentation, and my reaction was acid. Lactose fermentation, acid gas. It is rather hard to see in the picture that I have provided, but there were bubbles at the top of that little glass tube, and it came back a bright yellow, indicating that there was indeed lactose fermentation. Sucrose fermentation, acid gas. In this picture, it is very, very, very clear to see that in the tube that I had, that there was plenty of gas, and it was an acid reaction due to its yellow color. My citrate use was very positive. You can tell that by the bright blue of the slant that I had that was originally green. And so it is using sodium citrate as a carbon source. My urease activity came back negative. Nothing really changed during the urease activity, so there was no urea hydrolysis. And here's my analysis. I have Enterobacter aerogenes. At least that's what everything points to. The relevance of Enterobacter aerogenes. Where it's found. It's found in soil, water, and the gastrointestinal tract. It is very, very, very opportunistic, especially since it is very common on us anyways. It's very common in hospitals. I'll get that into a little bit. Infections. It causes UTIs, respiratory infections. It festers in wounds and can be found in the bloodstream sometime. And transmission. It can be direct or indirect. So with the indirect, it's going to be more found in like your hospitals and your nursing homes. A lot of times in care of hospitals, people are already immunocompromised, so their body is more able to pick up on these bacteria that are opportunistic and giving them a chance to infect them. And that was my importance of, and that was my unknown bacteria data analysis. Thank you so much for watching, and I hope you have a good day.